All right, let's get started. Thank you everybody for joining us this crazy afternoon. Um, Today's topic of conversation for our water cooler conversation is Vaquero Health. And with us today is Eddie Quintanilla from Student Health Services. Welcome, Eddie.
Hello and welcome to Vaquero Health. My name is Eric Quintanilla and I'm the health coordinator for UTRGV Student Health. And my office is here located in Edinburgh, and we also have a clinic in Brownsville.
So before we begin, everyone, I just want to give everybody a quick disclaimer, just letting you know that the content of our presentation and this discussion today might be a little troubling or might be a little bit triggering. So just know that you are welcome to log off at any time. We don't mind. Please feel free to leave the discussion. We are a safe space and respect the boundaries of others, especially if the views or experiences are clearly troubling to them. So we're going to begin. Of course, we've already introduced Eddie. He's from Student Health. Of course, you can find him under Cesar Quintanilla on the directory, but everybody calls him Eddie around campus. And if you haven't seen Eddie around campus, look out for him when we go back to campus one of these days, because he's a blast to hang around with.
Thank you, Priscilla.
So for today, our objectives, guys, and what we want you all to get out of this little presentation is, of course, gaining an understanding of our student health services, identifying what can be provided within our student health service department, and of course, identifying the collaborators and the resources that work with Eddie and student health services. Amanda, were you going to say something? I'm sorry. Okay, just making sure. So let's begin, Eddie. Let's start with the big question that everybody always wants to know is who qualifies to receive services from the clinic?
Well, that's a very good question. Who can receive services at the clinic? And one of the first things I tell them is all students who are registered in the current semester and that they have on their bill a fee of student health services. And that qualifies all our students to get services at the clinic. The one thing that's going to disqualify you is if you're a student online and you're not paying those fees, or if a student is pregnant. And we do pregnancy tests here, and that disqualifies you because we're not a specialist clinic, and we would have to refer you out and you have to pay on your own.
How about if the student has health insurance?
Very good question. If student has a health insurance, and in some cases international students do, I recommend that they use their insurance and their private doctors for procedures that are for annual checkups or screenings that are free. And they can come to the clinic for other procedures that are of very low cost.
Okay, well that's good to know. I mean, we always sometimes have those questions about the insurances and the craziness of what to do, where to go. So that's thank you for letting us know that. Um, so give us a breakdown. I know you mentioned pregnancy tests. I know you mentioned a couple little things. Tell us more about what other services does the clinic provide? Like what can a student expect, or what might a student want to go get checked out for?
Okay, one of the things that the students can come to the clinic for is for general medicine. What is general medicine? General medicine is when you have a stomach infection, you have an earache, you have the flu, and here at the clinic, we have a lab, and you can also be seen for sexual transmitted diseases, HIV education, prevention, testing, and other specific procedures that you might need, and our doctors can help you with. But again, everything is general medicine. We don't see students with cancer. However, some people have gotten tested for certain lab work, and they are pre-screened by our doctors, and then they are referred out and they get the help that they need. And that is something really good because we are helping students to focus on their health and be able to prevent major illnesses.
So I know you mentioned doctors, and I want to just touch up on that really quick. Doctors, are they legit medical doctors, or are they students that are going through our School of Medicine program?
Very good question, Priscilla. A lot of the times, students might feel that, oh, well, the clinic is probably run by students from the School of Medicine, or we have students that might be practicing on students, and that's not the case. Everybody in the clinic is a professional. All our doctors, all our nurses, our PAs, our nurse practitioners, they are all certified by the health board, and the only time we have somebody that is going to be a student from School of Medicine is to shadow the doctor. And again, they go by all the trainings that we have for confidentiality agreement, which means that they cannot leak any information on your health or your status of health.
Great, and good thing, because I was going to ask you about confidentiality. I was going to ask you that if they have to abide by the same rules as any medical doctor, and of course, we also have to think about FERPA, which is the university standard for confidentiality. So thank you for letting us know about that. Now I'm going to quickly jump back to the previous thing that I had asked you before. I know you mentioned that they can go in and seek services, but how are things how most of us, of course, are still working remotely, working from home, attending classes at home. What's the process or the procedure now for the health clinic when it comes to students seeking the help? Like, how has that changed now with COVID-19?
Okay, very good question. And yes, the protocols have changed in the past few months. As you can see, COVID has affected the way we do business most in everything, and it has impacted us. We're asking our students that if they have any questions on COVID or they want to get tested, they can go to the main website for UTRGV. They can click on the link, and for in our end, if a student is sick, not of COVID, of anything else, they can call the clinic and we'll share that information, the phone numbers and the locations later on. But students can call in, make an appointment still. But when they come to the clinic, and remember, this is not COVID related. This is for some
Yeah.
for any other general medicine. They can come into the clinic. Outside the clinic, there's our number. They can call in and they're pre-screened for COVID. You know, the question, have you ever had COVID? Have you ever been tested? Have you had any symptoms? So that has changed. So students, before walking into the clinic, they are asked to call from outside to be pre-screened. The other thing that we ask it to come alone, to only come one person at a time. We have some students who come with a friend, sometimes mom and dad, and we have to tell them, you know, they need to be outside. We are trying to limit the people inside the clinic. We have 12 staff members that are always, you know, wearing their masks, their N95s. And again, it's for everybody's safety. And that's how COVID has impacted our current situation with seeing patients. The other side, and I'm going to add this to this question, Priscilla,
Mhm.
is that when people feel that they might have been exposed to COVID and they need to get tested, they need to go to the website, like I said, at UTRGV, and the hyperlink, it says COVID, latest information on COVID. They can click on the link, fill out a form. After that form gets filled, they submit it, and then one of our staff members calls them to pre-screen and then give them an appointment for free testing.
And where's the testing at?
We have the testing here at the clinic, but we are sending most everybody to the community area, which is right behind the health,
E-Labs, what is it?
health,
E-Labs North. I know
ELAB.
the acronym.
Yeah. Okay. I know they changed a little bit. The nurse.
Liberal Arts Building North. That's the
Yes.
official name.
Thank you so much, Priscilla. Liberal arts. Behind liberal arts.
Cool. So how, I know you mentioned student services fee, and most students who, or yeah, I would say most students who pay that student services fee get to go to the clinic. So is everything free in the clinic, or is there something that will be charged for?
Okay,
How
let's
does that
cover
work?
that up with the student fee. What you're paying with the student fee, it's a minimum of, I think it's like $75. And what you're getting for those $75 is free consultation. And from there, we move on to everything being at cost. So I'm just gonna give you an example. In the clinic in Edinburgh, we have a pharmacy. In Brownsville, we don't. So here in Edinburgh, if you get a prescription for an antibiotic, let's say, and I always tell people the cheapest place for medicine is Walmart. Well, if at Walmart that medication is $10, with us it's going to be $5. So again, we're giving you everything at cost, and that also goes for lab work, procedures, or any type of service you get here at the clinic. Everything's going to be at cost. And if you don't have money to pay for these services, you can put it on your student account, and you cannot be penalized, or you cannot be have holds for amounts less than $600.
You
So
read my mind. I was about to ask you about that.
and so again, don't let not having money get in the way of your health. Please come and see us. Please come and take care of your health, and then pay with your student account if possible, and get better as soon as possible so you can go back to class.
Cool. Well, I mean, that's great to know because I know sometimes I mean, I remember when I was a student, I didn't always have money. I would finish my financial aid and then I would just pretty much suffer. So knowing that I could put it on my student account and still get my health taken care of is actually really great. Um, so the other thing I wanted to ask, flu season is coming around. So not only do we have to worry about COVID-19, but now we have to start worrying about the flu season. Can students go to the clinic to get their flu shot?
Yes, definitely. We still have some flu shots for free. And I always tell students, it's not the most comfortable thing. And, I told you I got my flu shot. I was very brave and I got it. And, I was like, yes, let me get it. And so I was uncomfortable for a couple of days with the shot, you know, but I feel safe that I'm covered for the flu. And if I get it, it's not going to be so bad. And very, very important that you mentioned that now we're not just fighting the flu, but COVID is side by side. We have other, the West Nile, the dengue fever going on. So again, always stay on top of your health. Let's say you come in, you get your flu shot, and you get screened for something else. That's the best way to start getting uh, in touch with our doctors, creating a working relationship to better your health. And a lot of the times, and I don't think I mentioned this, sometimes students come in for like something very simple, like lab work, and then they wind up telling us, hey, you know what? I also want to get treated for this. And that's where we know that we're doing the right thing here, helping our students stay on top of their health.
Well, I mean, that's great to know because that's, like I said, the most important thing right now is making sure everybody is safe and healthy. So what if, and I'm going to use Amanda because I mean, why not, Amanda? You're my friend. Uh, what if Amanda, or what if somebody just in general is going to is no I'm not going to use Amanda because then it'll sound weird. What if somebody in general is wanting to get tested for STD, STIs, or I know you mentioned pregnancy. um do you all provide the free testing there, or what is there somewhere you all refer to? How does that work?
Okay, really, really good question. Uh, STDs, HIV, pregnancy testing, they're all done here at a low cost. Okay, again, that's the main thing. It's going to be at low cost. However, there's other agencies, around us like Valley Ace Council, Esperanza Access Clinic, and they have very similar services as us. And I also recommend. I also tell students, you can access those services. Those services are on income based. So again, a lot of times they do have money on grants that can help our students, and sometimes they don't. But I will tell you, they are very professional, and I highly recommend them too. Because again, let's say you just don't feel comfortable coming here to the clinic for whatever reason. I want you to know that there's help for you even out there.
So I know, and this is something we used to do, Eddie, every year we used to do the condom card around campus, decorate our golf cart and go give out free stuff to students around campus. Do you still provide those free products? Do you provide the free condoms and stuff like that?
Yes, at the clinic here in Edinburgh and the clinic in Brownsville, we do have condoms. We do have female sanitary pads and other things that you might need. Um, and also, these are free. And I always tell students, it says they're free, but you're paying for them. So if you ever in need of these items, take advantage. Don't be shy. Don't be afraid. You know, come and check the clinic and see what your fees that you pay for can do for you. and relate this information to your friends, because your friends are going to talk to you. They're not going to talk to me or Priscilla or Amanda. They're going to talk to you. Share this information with your friends. Hey, we are paying fees, and there's free stuff for us, which is not free, because we're paying for them. But come to the clinic, get information, talk to other uh, departments or programs on campus and see what you can have.
Now, I'm going to ask you a little bit of a more serious question here. I know it's something people might have gone through or might experience or might not know what to do in these situations. As you know, I, of course, work with uh, victims and survivors of domestic violence. So if a student were to be in that type of situation, they're not ready to go to law enforcement and see Amanda yet, or they're not ready to come to me and see me yet. But they're worried about their health. They're worried about maybe the abuse that they have gone through, and they go to student health. Would you all be able to assist them? And if so, would you get law enforcement involved, or would you have would they have to file a report once they're there seeing you all?
Well, again, everything's confidential. And yes, a student may be affected by sexual assault or any type of assault, and they can come to the clinic and be seen. Once they're here, I uh, our staff members can talk to them and say, you know what, and some of these students may disclose the situation. Some of them may choose not to. But if they choose to say, hey, I think I was assaulted, this happened to me, our staff members our clinic personnel are ready to tell you, you know what, there is these services on campus. There is PD, advocacy victims, Miss Amanda Quintanilla. We also have OVAP. But again, it's up to the discretion of the person to feel comfortable. We are not going to call you unless the person wants to. And you might have experience, Priscilla, where somebody says, well, no, I don't want to do nothing right now. I don't want to cause any problems. But then they come back and I don't know, maybe a week or two, and they say, you know what? Remember I came and, this happened to me and you mentioned about these services. Can I talk to them? And so that's when we can say, okay, here's the information. We can call them or you can call them and they can help you navigate through your situation. But again, everything's confidential. We cannot call police department. We cannot call about. It has to be with the consent of the person, and we give them those options.
And do you all keep notations there at the clinic that the student disclose these things, like for future reference, should they want to? Like you said, in the future, if they do come back and want to pursue other means, can they? Do you all write those things down, or?
The provider, the doctor or the
Mhm.
nurse, they're supposed to write notes for everything.
Okay.
They can, so that let's say, and I do health education. So let's say somebody says, well, I need to speak to somebody about STDs. And if they talk to me and they say, well, Eddie, I needed to know about this because this happened, only people in the clinic or the providers can see those notes.
Okay, great. Well, that's good. I mean, that's great to know because I know sometimes with these issues, these topics, it- because of the severity of how it can impact a person, I know sometimes they just don't aren't ready or don't want to tell anybody about it. So that's great to know that they can go to you all and get still seen without worrying that other people will find out about their situation.
Yes.
So I know, Eddie, you mentioned that you're the health educator. So what else do you do? I mean, besides talking to me right now, to me and Amanda about this stuff, what else do you do? Or what if somebody has questions, can they reach out to you? Can they call you?
Well, one of the things that I tell students is that my job is mainly to market the clinic to our students, but we also collaborate with different agencies on campus and off campus. Here at the university, the agencies that I try to work with is the police department, OVAP, the UREC. Sometimes we work with counseling. We work with off-campus agency with Mothers Against Drunk Drivers, Unidad, which is an agency that helps students to prevent underage drinking and driving, and drug prevention too. So again, we work with different programs to try to give our students resources so that they can navigate a healthier life in college.
Cool. So where can they find you? Tell us where we can find Eddie or where we can find these clinics that you work at.
Okay, Priscilla, am I gonna get a lot of calls?
You might, who knows? Hopefully, I mean,
Well, and again, I hope they're all for the right reasons. Is that they want to live a healthier life and they need information for resources. I'm here most of the times in Edinburgh. Sometimes I'll go to Brownsville, but they can find me on the directory, like you said, under Cesar Quintanilla. Everybody calls me Eddie because that's my middle name. But I'm here to help you navigate through college. I've been here 18 years. I was a student just like the students that are watching. Then I became a staff member. Every now and then I'll teach a class in kinesiology. And yes, if they have any questions, please contact me.
so where are your offices located? I know you said Edinburgh and Brownsville. Where exactly are they
We
located?
are located at 613 North Sugar Road, right here on Junior and Sugar, right next to the UREC. It's a one-story building, right? We see right in front into the pool. And in Brownsville, we have the clinic at Cortez Hall. And if you guys are familiar with Cortez Hall, on the north side, they have career services. And on the opposite side, on the south, that's where student health services is.
And what's the hours of operation? I know.
Hours of operation is 8 to 5. And sometimes students may say, well, 8 to 5, I'm always busy. Well, let me tell you, you can always call to make an appointment. I prefer that you call. I know there's a link on our website that you can make an appointment through the link, but sometimes students, may not pick the right provider that they want to see. And so I prefer that you make a phone call and make an appointment. We also have a nurse line that is a 24-hour nurse line. So let's say you feel sick today and there's no appointments today. Well, you can call the nurse line and you can talk to them about your symptoms, and they can help you make a better decision on what to do, whether it is just to buy something over the counter, or you know what, you may need to go to ER. But again, you have a professional talking to you. The nurse line number is on the website. It's 855-810-4457. But again, all this information is going to be on the website.
And we've also shared it on the chat. So if people need to write that down, it's on the chat. And of course, we will also be emailing out this information to everybody that attended today.
Okay, I see it. Yeah.
Okay. So let me see, what else do we have on our PowerPoint here? Oh, there's the resources. So there's Eddie's number, UT Health Student Services. Those are the numbers. And then of course, here's the 24-hour nurses line that we just also posted. Amanda, I know, did you want to ask anything, Amanda?
No, you pretty much covered everything that we had wanted to discuss. Times are very different considering we are in the life of COVID now, unfortunately. A lot of people might not know that we do a lot of collaborations together, and on campus we would be at the library or the student union at least once or twice a week every month for different table events. So hopefully within the maybe next year or so, we'll get to be back together, passing out goodies, information, engaging with student and staff population. But
so anything
more of a comment, I guess.
Yeah.
Sorry.
It's okay. It works. Anything you want to leave the students or let the students know? What's the most important thing you would want the students to know, Eddie, about the health services, about the student health clinic?
Okay. I'm glad you mentioned what's the most important thing I want to leave them with. The most important thing I want to leave them with is that their health is very, very important. And you guys, as students, are paying a fee to have professionals here to take care of your health. And even if you have a question, let's say, you have a question about the day after pill and you want to talk to somebody, not just Google it or hear it from a friend, you can come to the clinic, talk to our pharmacy technician, talk to one of our nurses in Brownsville or Edinburgh, make that phone call, make an appointment, take charge of your health. I know a lot of students back in high school, you have the nurse there and mom and dad take care of you. Well, now you're getting ready for the real world. And the clinic here is like your first step of like, okay, I'm not by myself. I still have people that care about me. but it's baby steps. Once you graduate and you have to get your own health insurance and you have to go into the real world, a lot of things are going to be costing you more. And we can talk about this, Priscilla, the women's wellness checkups. Those are like $60, but anywhere else they're like $120. The men's screenings for STDs are $45. Anywhere else they're like 150. The other one is called the executive lab work, and that one is to check your thyroid, your cholesterol, your kidney function, your liver function. That one with us is only $35. Anywhere else is 120. So again, if you take anything from here, is start taking care of your health. Talk to the professionals that you have here with us at both sites in Edinburgh or in Brownsville.
So, well, thank you for that information, Eddie. And that's interesting to hear the price differences on some of the things that you all deal with. I have a question that came in through the chat. Does the clinic help students who have children?
The clinic is only for students themselves. It's not for family members. It's not for any other relatives but themselves.
Okay, and do the dependents also gain any benefits from these?
No.
Okay.
Good questions.
Anybody else that wants to ask questions, you're more than welcome to ask them in the chat.
Priscilla, may I
Yes,
mention
sir.
also that the name change, we're now UT Health RGV, Student Health. That's what we're called now. And for purpose of branding now our, School of Medicine, we do have UT Health RGV clinics across the valley, but those are for the community. The ones for the students is the ones here on campus. Now, there are some services, again, that are free to the community in those areas. And so students may take advantage of that too, because those are free. Those are grants, and those are UT Health RGV branding.
Well, that's very interesting to know. Thank you. I didn't even know that part. Anybody else have any questions?
The other thing, Priscilla, is for our students to be patient with us with these new protocols. COVID-19 changes daily. I was the other day doing a presentation and I was talking about the hyperlink and what to do. And one of the doctors told me, well, Eddie, tell them to do this now, what I just told you about COVID. And I said, why? He says, Eddie, COVID-19 changes protocols daily. Everything changes. So again, be up to date, but also be patient, call us and stay on top of your health.
So, okay. So just, I guess one last time, Eddie, before we finish this, one last time, give us your phone numbers for both the Edinburgh Clinic and the Brownsville Clinic.
Okay, let me give you our address. Is in Edinburgh is 613 North Sugar Road, Edinburgh, Texas. And our phone number there is 665-2511. In Brownsville is going to be Cortez Hall, Suite 237. And the phone number there is going to be 956-882-3896.
Cool. Well, thank you so much, Eddie, for joining us today and sharing your wealth of knowledge that you have about Student Health Clinic. Thank you for joining us today. Thank you for sharing your wealth of knowledge with us today. Like I said, everybody, if you all are interested or have more questions for Eddie, please give him a call to the clinic or give the clinic a call and ask the questions. They're there to help you. They provide the services. You're paying for them, so take advantage of them. And I think that's it for today. Anything else, Amanda, that I missed?
No, just thank you all for joining us, and we hope to see you again at another water cooler conversation.
Thank you, everybody, for showing up and
be safe. Yeah. Thanks, Eddie. Bye.
Thank you, everyone. Bye.
Thank you.